Hi dear students, in this special series on subject-wise strategy, we are going to identify all the important topics that you must keep in mind before you start working on a subject. We'll be looking at the trend for each subject and then mapping it to all the tasks in the app so that you can prepare better and score better. In this video, we are going to look at the preparation strategy for public health dentistry, which is one of the most feared subjects amongst dental students. Now, the fear is legit because there are a lot of conceptual questions from research methodology and biostatistics. And this subject individually is very important because there are very specific kind of questions that you can expect from here. Now, the trend of public health dentistry has been very consistent, and that's one good thing and bad thing. Good because you know what to expect and how many questions, how much time to dedicate, and bad because it can be a challenging subject with regards to the concepts. Now, which topics are parallel? Not a lot goes very hand in hand with regards to public health dentistry. A little bit of preventive dentistry, and you can say pediatric dentistry and fluorides go hand in hand with community. But the major chunk of public health dentistry is actually research methodology, epidemiology, and biostatistics. Now, in order to understand how detailed should be your preparation with regards to biostatistics and the other important topics in public health dentistry, we are going to look at all of the previous year question papers, NEET MDS papers, and assign them to the specific topics on the left hand side. Now, here we've split down a lot of big topics into smaller topics so that it's clear for you to understand and it's more transparent in terms of your preparation strategy, right? So we have health organizations, biostats, epidemiology split into a couple of topics, and then we have clubbed a few smaller topics together like jurisprudence and ethics and fee payment and auxiliaries, and now we'll be looking at the questions on the right side. So let's start with the first one, the epidemiology. In epidemiological study, the first case that comes is called the index case. Types of bias avoided in double blinding is interviewer bias. So you have to know which types of bias are associated with which type of study. Then lead time means the time between first possible point to usual time of diagnosis. Then prevention of diabetic cancer, hypertension comes under which of the following? It comes under social engineering phase. Level of prevention which aims to reduce the incidence of disease is called primary prevention. So that's a preventive dentistry question. Then that's a fluoride question. What is the recommended fluoride supplementation for this patient? A 32-year-old female with uncontrolled diabetes reported to the clinic with left eye blindness, blackish discharge. This is all mucormycosis. Now, the reason we've put mucormycosis here in community medicine is because of the COVID pandemic and the after effects of that. Otherwise, this question also fits in OPATH. Teacher had demonstrated various brushing techniques. So that's health education. Chronic smoker had episodes of coughing and respiratory difficulty. He was advised to quit smoking and the phases of that. So contemplation, that's health education and community medicine both. A chart with bars representing classes divided into constituent parts known as component bar graph. Changing concepts of public health. So different phases. Highest level of evidence is through meta-analysis and systematic review. Which of the following eliminates inequities in accessibility to health awareness in varied countries? So that's a Yojana. To compare the effect of drug dosage and treatment in more than two groups, the test of significance would be ANOVA. Examiner controlled exposure study is called cross-sectional study. Patient has deep pit and fissure in posterior teeth. So this is a question on ART. Right, so this is so far last year's NEET paper. And although you may feel that research and biostatistics comprises the majority of your questions in exam, it may not necessarily be true for every exam, because as you can see here in this year's paper, only 2 questions appear from biostatistics and rest all of them are from different topics. So you have to maintain the balance of your preparation when you are looking at public health. Let's continue looking at more questions now. Knutson's technique and the age group, so that's fluorides. Now, of course, you can always look at the explanation. The explanation will also have a key concept which will help you reinforce the idea. Another very important way of learning through these explanations are the explanatory videos, because they contain a lot of additional information. It's more interactive. It talks about how to eliminate certain options and starts building in a lot of strategy in your mind with regards to question solving. So make sure that you watch explanatory videos in questions wherever you find them. Then next question is on osteomyelitis. This is fungal osteomyelitis. So we'll put them in community medicine with Mucor. The ability of the test to correctly identify who do not have the disease is specificity. Now you must know the definition of sensitivity and specificity. True negative, true positive, false negative, false positive. All these are important. It is the amount of previously unrecognized disease that is diagnosed as a result of screening. The definition of yield. Usefulness of a screening test depends on its sensitivity. The most sensitive index for fluorosis is option 3, which is very difficult to say. Thilstrup and Fedorskov index. Type 1 error means rejecting a null hypothesis when it is true. Which of the following sampling methods would be least efficient in homogeneous population? Stratified sampling, that goes to sampling. So you can see the blinking on the left side. Then a 21-year-old female reported to the dental clinic for her routine dental checkup. On examination, it was noticed she had 2 decayed teeth, 1 missing due to caries. So this is DMFT applied question. Index. Time interval recommended for incremental care for public health is 12 months in India. Researcher had conducted a study between tobacco and cancer. He found that some patients also had a habit of alcohol, which is a bias. It is a kind of confounding bias. In 2017, a research was conducted among all dental colleges of India, and there is a sampling method that they have described. This is multi-stage sampling. So you can get a lot of applied questions on sampling. They will give you a situation and you have to identify what method of sampling that is. Next, occurrence of new carious lesions is assessed by chi-square test. Patient pays a sum to the dentist irrespective of the treatment or not. This is known as capitation plan, which is a part of insurance payment. Chronic kidney disease, which is associated with multiple etiologic factor and not only one factor, can be best explained by web of causation. It's very easy to get confused in a lot of options here. So keep an eye on how to eliminate options. Of course, you can read the explanation and the video is attached. A 4-year-old child living in an area with water fluoride content 0.5 parts per million should be given supplemental fluoride of how much? So that's a fluoride question. Then we have a question on prevention. DI score, CI score. So what is the OHIS index? Patient with temporary restoration on 4 fractured anterior teeth, 6 teeth with chalky, and this is all DMFT. So how to calculate DMFT score? Next question, which of the following fluoride preparation combines with hydroxyapatite crystals to form calcium fluoride? And the answer is sodium fluoride. A dentist from Australia wants to get IDA membership to practice in India. Really? Under which category would he be placed? Affiliate member. In a school, children from a class were examined and those with some visible lesions were shortlisted, and this is an example of multi-phase sampling in the question. Hypertensive drugs were used in pregnant and non-pregnant groups. Which test of significance? T-test, student T-test. So as you can see, we are allocating all these questions to specific topics on the left side, and they'll blink whenever there is an allocation. You will see a change in the number of questions allocated to. A study was conducted on 2 groups of people. One was given a drug for a disease, new drug for disease, while the other was not. So this is a crossover study. Test of significance for comparing the effect of 3 drugs on mean blood pressure before and after will be done by paired t-test. This is the explanation for paired t-test. Make sure you look at the key concepts. Take a note of all of this in your workbook because that will be very helpful. You will have the skeleton for this in the workbook. You just need to fill up all the important data. So that gives you a repeated practice of the whole subject. Plus, you can also make notes on the side. If you come across any good question, use workbooks efficiently. The most effective fluoride content is found in stannous fluoride. 2 women are tested to diagnose the presence of anemia. The test of significance to be used is chi-square test. Which of the following is a caries causing element? We'll put that under caries susceptibility and caries activity test. During CPIT and index survey, pocket depths were measured. The indicated treatment according to that reading. So that goes to index. In a village, a camp is set where a group of people are checked for occurrence of disease but do not intend to actively treat the disease. This is known as screening. So that goes to survey and planning. All questions on screening will be under survey and planning. A list of students was generated ranking from 1 to 10. This type of data is an ordinal data. Type of screening which uses tongue depressor and available illumination for public health survey is called type 4 screening. You can know more about different types of screening according to the ADA from this explanation. The type of association between high altitude and endemic goiter is indirect association. Index used for awareness of patients of the carious teeth in their mouth is significant caries index. Study was conducted on 6,000 patients with dyslipidemia to study the association of stroke and occurrence of stroke in such patients. This is known as a cross-sectional study at a given point of time. So that goes to analytical epidemiology. In a class of 400 students, only 20 are required for a particular study. The best possible way to choose is to systematic random sampling. Choking off effect is seen in which of the following? Sodium fluoride. The type of discussion that involves 4 to 8 experts in front of a group is a panel discussion or a viva. A patient has multiple white spots in teeth and gives no history of fluoride excess in that region. Which fluoride is the best treatment of choice? APF. So a lot of questions from fluoride popping up. In a dental clinic, auxiliary performs duties after personal diagnosis and direction of dentist and the patient is sent after his clearance. This is known as direct guidance or supervision. All of the following are different types of needs of dental care except, then role of humectants. This can also come under dental materials, but we'll put it under preventive dentistry. Humectant is to retain the moisture. Reverse smoking is seen in Andhra Pradesh. An active carious lesion can be stopped from progression by application of silver diamine fluoride. 4th generation pit and fissure sealants. This is preventive dentistry. Theme by WHO for the year 2018 is health for all. All WHO themes, in fact the current theme should be most important. Like you can see in 2019 they asked the 2018 theme. So you should know the themes plus 1 year from the previous exam. Screening of oral cancer comes under which level of prevention? Levels of prevention, preventive dentistry. Caries promoting mineral, repeat question, selenium. Developing an answer or a solution to an already known problem or a question which can be quantified and analyzed is called as hypothesis. Meta-analysis is very important part of research. It provides quantitative summary measures from many studies. First and foremost step in biomedical waste disposal is to segregate everything. So that goes to waste management. It's here at the bottom. Comparing means of 3 different groups or data set is done by one-way ANOVA. Strobe guidelines are applied to observational studies. Dental health survey in a community helps to establish what type of needs of the population. So normative needs. Sequence of contents in scientific report of oral health survey. So anything which is surveyed will have aim, material and method, result and conclusion. A person who assists the dentist in the clinic but is not allowed to treat patient independently is a dental assistant. Pulpotomy comes under tertiary level of prevention. Proportion of population which is included in the study sample is called sampling fraction. Which of the following has got the highest fluoride content? Durafard. In case of confounding variables, which type of association is seen between the disease and the factor? Indirect association. And a similar question was seen earlier, but the language was different and it was reverse. So it was saying indirect association, and then we had to talk of confounding variables. Which of the following test is applied in case of sample size greater than 30, which is following normal distribution? A Z test. Which of the following is true about epidemiological survey as compared to clinical trial? So there are 4 options, and then we have to pick out which one's true for epidemiological survey. Ability of the test to correctly identify. This is a repeat question from 2022 sensitivity. Reference range for Pathfinder survey. Direct question. Same exam, another question on Pathfinder survey on the sample size. Integrated Child Development Scheme in India comes under which ministry? That's Health Organization. Sequence of contents in scientific report of oral survey. Repeat question. Role of humectants, again a repeat question. Fluoride containing pit and fissure sealants come under 4th generation. This is a repeat question. Person who assists in clinic but is not allowed to treat is a repeat question. When chlorate in water starts to disappear and free chlorine starts to appear, it is known as break point. Simplest commonly used method of measuring variation in a population is standard deviation. Ideal requirement of pit and fissure, it should have adequate working time. Now, we've gone through all the questions from the past NEET MDS exam, and what we see is a lot of questions appear from preventive dentistry, levels of prevention and basic preventive techniques like pit and fissure sealants, atraumatic restorative technique. And then biostatistics together, all 3 of them have 23 questions out of 89. That's a big number, and you should focus a lot on biostatistics. It should be rather your priority when you're preparing for this. Now, I know that a lot of students find this very difficult. So in order to have a good flow of everything and to make sure that you are having enough content to read, we have all of this categorized into small tasks. For example, if you want to prepare, say, any of this topic, let's prepare introduction and measures in epidemiology. And then when you view the text, you will have an idea because it is all consolidated, it is all concise, and it's in flowcharts and tables, and it's easy to remember. And of course, when you have the workbook, you can write down your own notes on the side. All the formula are in one place. It's all very precise and it's well sorted. So you can go through your videos here. You can also look at a lot of video content with MCQ videos. So once you prepare one topic, the next thing is to practice your questions and then take a test. And keep doing that for all the tasks. You must complete all the tasks in this given subject. Okay, so once the tasks are completed, you will have enough foundation, you will have the basic knowledge to tackle more extensive questions in the Q bank. And then once you practice the Q bank, the next step would be to take the weekly checkpoint test and make sure that you are reviewing all the answers while you are preparing them. And now I will tell you how to maximize your preparation with Meritor's app. Now there are 5 things to keep in mind when you start your preparation for any subject at any given point of time. Number 1 is to start with tasks. Like I said, tasks are the building blocks. They are your foundation and fundamental for any subject. You need to start preparing for the task with the workbook. You must look at the video if you have any doubts regarding the topic, and then practice questions. And then you can take the test. Now, whenever you are taking a test or practicing questions, each question comes with the answer, explanation and key concept. The explanation will be elaborate. It will tell you everything that you need to know about the topic. It is a good source of taking down notes because a lot of additional questions can be asked from the existing explanations, right? And if you are well versed with the topic, you can just look at the key concept and reinforce the topic in your mind. Additionally, a lot of questions also come with multiple choice question videos, which are explanatory videos. They are going to talk about how to eliminate options, how to strategically focus on the question, and additional knowledge that comes with the topic. So your first aim should be to complete all these tasks for a given subject and then move on to the next thing, that is Q bank. Now Q bank or question bank is a collection of high yield extensive questions. They are clubbed together in topics, they are clubbed together chapter wise, and you will have more hands-on experience on difficult and extensive preparation on these questions. Again, they will come with explanatory videos, explanations and key concepts. So once your tasks and Q bank for a given subject are complete, you are good to appear for the weekly checkpoint tests. Now the tests are of two types in the app. One is the weekly checkpoint test and self-paced test. I'll tell you about the weekly checkpoint test first. So suppose if you are preparing one subject over the week, then at the end of the week you will have a test which is going to focus on that specific subject plus the subjects that were previously prepared, right? So that kind of snowballs the entire revision strategy. You will have a repeated encounter of multiple subjects from time to time. So you do not forget. It's easier to keep these topics in mind when you constantly see them. So the revision is reinforced. Plus you also get personalized AI recommendations, right? So at the end of your test, based on your performance, you will get how many questions you answered, what was the score, how much was the negative marking, where are you lacking, what are your stronger points, and then it will tell you how much time to dedicate for a revision of your weaker subjects. So with this strategy, you will be able to focus on specific areas that are your weaknesses. Now that is an exceptional feature of Meritor's app. And the next set of tests is self-paced test, which you can take at any given point of time. These are subject-wise tests. You can also have cumulative tests, multiple recall questions also incorporated in form of tests. And towards the end of your preparation phase, you will have a lot of volatile, factual, high-yield questions in form of final strokes, which are again specialized tests to be able to remember these topics clearly before the exam. Now, once you come closer towards the end of your preparation, you will have access to this special feature of the app called Marathon. This is activated towards the end of your preparation, where you will have 3,500 plus high yield questions. High yield questions meaning they have the chances to be seen in the exam, because either they are based on recall questions or because they are based on important concepts that are repeatedly seen in the exam. So when you practice these 3,500 plus questions, you will also enter an all India competition where you will get a fair idea as to how your performance is with comparison to your colleagues. It's a great boost of confidence if you take it at the right time. And lastly, we have the all famous national mocks, which is a pan-India or all India nationwide simulation of NEET MDS exam. We conduct them towards the end of your preparation in a few months to go. And every weekend you will have access to this special test. You will see a lot of new questions in national mocks which are based on important topics. So do not miss national mocks, because it gives you a good hands-on experience of the exam. It gives you an idea of time management, because this is exactly according to NEET pattern, that is 240 questions and 3 hours with negative marking. So you kind of get a very fair and square idea of your performance, because this is again an all India competitive mock exam, and you will get personalized AI recommendations here as well. Now they are more important for national mocks too, because towards the end when you are revising, you will not know which subject to pick up at what time, and your performance in the national mock will be assessed thoroughly, and you will get your AI recommendations which will tell you which subjects to revise. So make sure that you are making use of all of these features in the app. Now, apart from that, if there is any query that you have while solving your questions, if you have any doubts regarding any topics, you can always contact the faculty on the WhatsApp group. We are always here to help you. And I hope with this in mind, you will be able to channelize all your preparation strategy in the right direction. And I hope we'll be able to help you achieve your dream seat in MDS. Thank you so much and good luck from Team Meritors.